In this video, I'm going to make the case that the COVID-19 disease burden in the United States is much higher than the officially reported number by the CDC, which at the time of making this video is about 1,300 people or so. There's been this argument made by commentators of this disease that the United States is a large country of 325 million, and in such a large population, a number like 1,300 is small, so we don't really have the same kind of problem that Italy or China has. The implication also is that we probably won't have a problem like Italy or China, but in my opinion, that is a false narrative. I want to remind you that COVID-19 is particularly infectious. The spread of the disease all over the world in just a couple of months is proof of that, but in addition, we also know that the virus shedding rate is a lot higher than that of the flu or the common cold. An asymptomatic person can easily shed the virus through the respiratory tract and infect multiple people in the same confined space, like an office, a bus, train, plane, or a home. One person can infect several more, and each of these infected people can infect more in turn. This results in an exponential spread of disease, and within just days or weeks, a single infected person can turn into hundreds or thousands of cases. The virus can lay dormant on surfaces like door handles, phones, and pretty much anything else for days. So even if there isn't a sick individual near you, a surface that they've touched hours ago might be the vector of disease that completes the transmission. The number one reason that I feel that the disease burden is much higher in the US is because we have been extremely deficient in our testing capacity. Of all of the developed countries affected by COVID-19, the American response has by far been the worst. Even today, almost 8 weeks after COVID-19 made landfall in the United States, we have only tested a few thousand people. In the same time frame, South Korea, a much smaller country, tested close to 100,000 people. So whenever you hear anyone on the news say that the disease burden in the US is low, and there's really no reason to worry about the spread, just ask yourself how that statement can possibly be accurate if only a few thousand tests have been conducted to date. If we tested our population at the same per capita rate as South Korea, we should have by now done 615,000 tests. So we are behind by a factor of 300. Now, by the time that there were just 300 confirmed cases in Wuhan, a city of 11 million people, the Chinese government shut the entire city down. All commerce was stopped, no one was going to work, and everyone was under strict orders to stay at home. And that, by the way, was 300 confirmed cases with a lot of testing being made available. Now, to date, King County, Washington, which has a much smaller population than Wuhan and is actually smaller than Wuhan, is fast approaching 300 confirmed cases, and that is with a meager amount of testing. So in all of this time, in the last 8 weeks since the virus first emerged in Washington state, there has been no lockdown, if anything. Sporting events, schools, commerce, commuting, everything went on as usual, and there is no doubt in my mind that the virus kept spreading at an exponential rate. There has been a lot of criticism, fair and valid criticism, that the lack of testing kits has prevented us from truly appreciating how grave the COVID-19 situation in the United States is. Every day that passes without us knowing the true extent of disease burden is a day that the virus has continued to spread at an exponential rate. And I'll say it again. The only reason that the number of cases in the United States is much lower than that of China or South Korea is because we have not been aggressive at testing for it. Now, this will hopefully change very soon. The sooner the better. But what I would like you to get out of this video is the realization that we have been extremely behind when it comes to detecting the disease up to this point. A light will soon be shined on the extent of disease burden in this country, and I'm afraid that it's not going to be good. We know that this virus is highly communicable. We know that in Washington state, like in other parts of the country where there has been clusters of infection, people have been carrying on their normal day-to-day lives. And there is no doubt in my mind that the virus has been spreading for weeks here. I would like for this not to be the case. But when you combine the communicability of COVID-19 and then multiply it by the time that it has had to spread undetected, then there is no other conclusion that I can reach other than thinking that the disease burden is much, much higher than the official count. Now, according to the Italian experience, about 20% of patients who are infected need to be hospitalized. So I think that very soon we will start to see the healthcare system in the United States find itself to be extremely stressed. Testing is ramping up as we speak because the government is finally beginning to realize how bad this is. But from everything that I know thus far of this disease, The true number of infected people isn't just 1,300 affected cases, but probably already in the tens of thousands, if not over 100,000 already. Now, I'll be following this very closely. I'll be continuing to make regular updates and comment on different aspects of this pandemic. So if you'd like to hear more from me, go ahead and subscribe to the channel if you'd like to follow along.